Good evening, ladies and gentlemen, and welcome to On Point with Cynthia Hardy. Thank you all so very much for tuning in to our show today. We have a live broadcast. We're broadcasting live from the Tillis Center at 2111 Simpkins Lane here in Columbia. Thanks to the Housing Authority, we appreciate the opportunity to be here. The town hall is sponsored today by PALS, Palmetto AIDS Life Support Services, and we are appreciative. We want everyone to know that June 27th is National HIV Testing Day, and it's not just observed around the country, but it's also very concentrated in a number of our local communities, which is important because sometimes when we have a national observation, we don't see it drilled down into local communities, and that's not the case here, thanks to organizations like PALS. It was important to the individuals at Palmetto AIDS Life Support Services to have today's event. Carmen Julius is the CEO, the president and CEO of PALS, and she's leading today's effort. On our panel today, we have Bobby Rogers. He's High-Risk Negative Program Coordinator, STD HIV Division Bureau of Communicable Disease and Prevention at South Carolina Health and Environmental Department of Health and Environmental Control. Reverend Sean Torres is on our panel today, community advocate and PALS board member. Francine Hopkins, community advocate, is also on our panel, as well as Marnie Robinson, who is with us, who does our On Point News and Views. We're going to ask if Carmen Julius will start with a comment or two about the significance of being here today. Carmen.
Well, we thought it was important to re-emphasize the importance of knowing your status, of knowing how HIV is transmitted and how it is not transmitted. And also we have a message that we want to get out today about PrEP, that there is a medical intervention that can keep people healthy and keep people safe. And that is something that we have found in communities of color. There is not enough information about PrEP and other risk-reducing interventions. We thought it was important today that we talk about the efforts that are being made to keep our communities healthy and keep people in our communities healthy. We have a message about how HIV interacts with mental health, and a message of that we call stigma, but it's really HIV shaming.
That's right.
That keeps people from being tested and keep people from engaging in care.
That's right. Yeah.
So we want to talk about those issues today, and it's very special this week of HIV testing week that these messages get out in our communities.
Now, you're doing a number of things to make sure that the message gets out. One of the things that you're doing is sponsoring tonight's show, and we're live in the community. And it's important to sit here with this studio audience so that we are live, because I think that says to the people that you're accessible.
Yeah. Absolutely, absolutely. We talked about that earlier. People don't always need to come to us. We can go into the community, and it's important that we do that. And we want to thank you, Cynthia, for your support over the years, and especially for today. Thank you.
Oh, absolutely, because I recognize that when we're ignorant, when we don't have the information, you know, it has an awful effect on us as far as our community is concerned. And so often, because we have been given a platform and because we do control our own editorial content, I think that's important, that we can create our own messages and create our own narratives so that we can target the information exactly the way that you want to. So that's why I'm so excited that we have the opportunity to work with you and work with your panel today, because it isn't just we're talking to somebody who heard something. We're talking to people who actually know the significance of what it is. Yes. Bobby, talk to us. We haven't heard from you yet, and we're anxious to hear from you about what you are seeing in the community in terms of your service.
So we're kind of seeing just as much as PALS, especially when it comes to accessing services and also with PrEP uptake. So we work very closely with all of our community partners to ensure that we're all on the same page. And with that, we are seeing a slight decrease in some of our HIV cases, and we can probably attribute that to, increased efforts of condom use and organizations like PALS doing an awesome job of condom distribution in communities, and also with their PrEP uptake. So we're seeing some results. Again, it will take some time in order to see drastic results, but the thing about it is we want to see some results, especially for the citizens of South Carolina.
Mm-hmm. Francine, you mentioned before we went on the air that sometimes when people look at who people are, where they come from, and their personal backgrounds that has something to do with whether or not they want to help as much. And you mentioned that your background was one that you may not be the proudest of, but it is what it is. And because of that, you want people to know about it. So how have you come about being so open about your past and all of that?
Well, it took a lot of therapy.
Because you talk about being on the street.
Yes, because what it is, when I first came up here, because I'm originally from Hampton County, I came here to come to treatment at Morris Village, but I met some people, and I met Sarah and Carmen at Pals when they was on Taylor Street. And they introduced me to some women's who empowered me through Women's Helping Women's. We was women's in recovery from drugs and alcohol. And what I've learned over the years by working with PALS, because I've worked with PALS in all capacities with linkage and different things like that. And what I've learned in doing outreach is that I'm dealing with the same population of people that I was. When I was homeless, when I was prostituting, when I was stealing, when I thought that I was no good, that my life didn't have no use, when I was women's are sexually molested, women's are raped, and our self-esteem is not where it's supposed to be. And that's another thing that keep women's from being tested, because then we don't think that we are worth it. You know, we don't think that we are entitled to being loved and actually love ourselves. But then through the process, I've learned that everything I went through, it was for a reason, so I can reach the people that God intended for me to reach.
Yeah.
They are the same people that's going through what I've been through, and yes, there's a way out.
So do you, So do you all find Ms. Hopkins' candor very refreshing on this topic?
Yes, absolutely.
Yes.
I do too. And I can see why you probably are a speaker in popular demand. So when you go into communities, walk us through what you say when you go. Do you knock on a door? Do you go into a church? What do you say? Do they look at you like you crazy? What?
Well, usually I'm on the side of the street in Lexington, or I'm underneath the tree in Lexington with alcoholics at, or I'm at the drug house, or I'm in the parking lot, or I'm at the barber shop, or I'm at the hood store. I might be at I'll be everywhere. I mean,
Well, Carmen, that's awesome, because Hopkins knows where to go and knows where to find the people.
And how to relate to the people once she gets there.
Oh, wow. And then that's got to be invaluable to you.
Absolutely, absolutely. And again, she mentioned Sarah McClam. She's trained by the best, and some
Tell
of
me
our,
about Sarah.
Well, Sarah, we call Sarah McClam the queen of outreach.
Okay.
I sit here in this chair, but I have a wonderful staff that makes me look good.
Right,
And Sarah worked with women like Francina and some of our other positive women, and really kind of gave them the tools that they needed, that they already had, but enhanced and brought them out, so that they are awesome in outreach. They're awesome in encouraging other women to get tested, awesome in engaging getting other women to engage in risk reduction behavior, and even getting them into medical care, and even getting them in to talk about PrEP.
One of the disappointments that a number of people have is the way our faith community responds to the issue. By show of hands, is that a problem in our community? If it is, okay, clap, because I forgot that this is so it is an issue in our community. Reverend Sean, how are we doing with that?
I don't think we're doing well, right? Because faith communities do not have healthy conversations around sex and or sexuality.
Oh yeah,
right?
We don't like to talk about sex in the church.
And the only time we talk about like LGBTQ issues is through the lens of HIV, which is also problematic, right? So we don't have healthy conversations in the church or in extensions of the church, which is the family structure, right? As a person living with HIV, and I've been living with HIV, this year would be 10 years that I've been living with HIV. I was diagnosed.
You all look great.
I was diagnosed when I was 18 in Philadelphia, and I tell this story often. And doing my physical for when I went to college, so I went to Benedict College, right? And the doctor handed me an envelope, and he said, find these people when you get to South Carolina.
Oh.
And that was the only conversation we had about my HIV status, right? So I was at Benedict, and I ended up walking to an agency, maybe my third day at Benedict, and was like, my doctor gave me this envelope, let's have this conversation, right? So I hid that from my family for a long time. And
How long is a long time?
for about 4 years, because my mother found 4 years. My mother found out on my college graduation day about my HIV status because, and I'm a snitch on it because she was snooping like mothers do. My mother was like, I was looking for your laptop, ma'am. My laptop was on my bed. So she was snooping, what mothers do, right? But that's the first time me and my mother had a conversation about my HIV status, 4 years after being diagnosed, right? But then that was the first time that I found out that I was not the only person in my family who was living with HIV, right? Both living and dead, right? I come from a long history of people who are living with HIV, right? People who are, again, still living and those who have transpired. But we don't have these conversations in the family structure. We don't have these conversations in church. We don't have these conversations in a healthy way. I'm taking it back, because we are talking about it. We're talking about people having sex when we're dedicating babies, right? But that's the only time we're talking about people having sex. Because we know people are having sex, whether they go to church or not. Because we keep baptizing or christening babies, right? So somebody's having sex, right? But that's the only time we talk about sex. And once we start having these open and honest and healthy conversations as religious leaders and faith communities, we'll always be behind the curve.
Marty, I understand that we also have a live stream that's going. We want to encourage people to participate in that live stream.
Yeah, absolutely. Please log on to, Michelle, you have PALS running, and Dex just posted something and tagged On Point with Cynthia Hardy. We're doing a live stream in the Big DM. Please log on and
participate and give us your questions.
Give us questions and all of that. And I like the comments coming from the faith community, but we're unique. Our church is unique because we've been having the discussion for a long time about HIV and AIDS, and so we do health fairs, and the truck comes out and you get your status when you get the test. So I encourage churches to do health fairs, and the truck will come out for free, and they'll test you as long as someone's in line, and they'll do tests and give you your status and give you instructions on what to do once you receive the status.
It's interesting because one of the questions that we had when we did the television show was it should be mandatory for everybody to be tested, right? Now I remember when I took my first test, I was nervous. I was nervous, And but I did it, because you needed to know that I was a single woman, and I needed to know. And I think that saying to people that if you've never had a test, then you owe yourself a test, because we have got to know. And sometimes, Marty, it's tough because you can be real scared, and not want to know. Have you all that are living that have experiences? Have you heard people say, "I'd rather not know," or do you find that people say that I'm glad I know because now I know what to do? Either one of you guys, Ms. Hopkins, Ms. Torres, but anybody.
So I think the pendulum swings both ways, right? There are people who say I don't want to know because I'm afraid, and there are people who said I'm glad I know. We talked about this recently about people are doing this cost-benefit analysis within themselves, and I'll talk about it forever, right?
What do you mean?
So a cost-benefit analysis of trying to
if I do
receive an
this,
HIV
then
test.
that?
If I take an HIV test, what will it cost me to know my status, whether it's a negative status or a positive status? I might lose my friends, I might lose my family. So these are the costs, right? But what I personally don't do well enough is transitioning people from talking about the cost to talking about the benefits of knowing your status, right? So if your test comes back negative, there are benefits to knowing that you're negative, right? We can connect you to PrEP services, we can connect you to other services that will reduce your risk for acquiring the HIV virus. And if I do know, then that means I can be connected to medical services early and then live a healthy life, as Ms. Carmen was talking about, or a longer life, or sustain a quality level of health throughout the entirety of my life.
Do we find that men who love other men sometimes are forced into the shadows because they feel like they will be shunned, and is that impacting women being affected with HIV/AIDS? I know I asked tough questions.
Yes. I have a friend that her husband was on the down low, and she got pregnant, and the baby, how she found out, and they went to church from the faith community, and when she found out that she was HIV positive and the husband transmitted to her, is when her baby was born, and unfortunately the baby died. And the husband is dead, and she is now one of my best friends that's still living in silence, because she is a part of the faith community and very engaged within the church.
But is she in treatment?
She is in treatment, but she has private insurance from Westinghouse. Yes, so I have.
So does that mean she's in care because she can afford to be in care?
Yes.
Okay.
Yes, but I also have people like the sex workers that work, they don't have insurance or anything like that. So I bring the information to them in order to, for them to get tested. And also I bring the safe sex kits and stuff for them so they can have safe sex also. But transportation is the #1 thing out in the rural area.
I do want to talk a little bit about people who are in the sex industry later on in the show, because again, it's one of those things we don't talk about,
Right.
and we think if we don't talk about it, then somehow it's not there, and that's just kind of crazy, and so you have to deal with how you are going to work with the sex workers, because their lives touch all of us in one way or another, right?
Yeah.
All right, your question, sir. Give us your name and your question.
My name is Darius Jones, and I'm actually responding to your question.
Yes, sir.
A little bit more about how, I guess you would say, down low, or in the closet, are just men who are not out about their sexuality and how it affects heterosexual women.
Right.
I mean, I believe that there's a lot to that person.
Okay.
Right? They're not just going through dealing with their sexuality. They're going through, not just dealing with that, but having to put on another face of, okay, I have this family.
Right.
Am I going to take care of this family, or am I going to be more selfish and think about my sexuality and do those things? I mean, by all means, they're not happy.
I
Point
got
blank,
you.
period. By all means, they're not happy.
So there are a number of men that, for whatever reasons, live those double lives and have those two faces.
Right, for whatever reasons. And I think a lot of has to do with society and how society look at gay individuals or people of the LGBTQI spectrum. And then how also people look at people who have HIV, who are living this experience. It's that alone, the stigma from that alone,
Right.
will cause anyone to shut down.
Yeah.
And just not talk to anyone or not deal with issues that they need to deal with and put forth. I mean, I do think that it is very unfortunate that you do have a lot of down low men out here who are bisexual or gay, who do sleep around with men and women and not being honest with none of their sex partners. Not just the women, but the men either. They're not being honest with none of their sex partners. No, I don't think that a lot of, I guess you could say, same gender loving men are causing a lot of
I don't think they cause a lot of it.
Are things to heterosexual women, especially if they're sleeping with them. I don't do that. I do think it happens.
Right.
And I do know it happens.
Right.
However, I do think that, like I was saying, them men have a lot of things that they're battling. And until they can, deal with those issues by themselves, they won't be able to express or live that happiness or that true life that they need to live.
Sure.
So yeah.
I want to follow up with okay, go ahead.
Can I add
Somebody wants to
something?
jump on in there.
So I do want us to broaden the conversation outside of like the male-female binary,
Right.
Right, because heterosexual men aren't just having sex with men and women; they're having sex with persons across the spectrum of gender identity and expression, right? That's one. And two, I was having a conversation with a lady named Cherie Scott, who is the CEO of an organization in Tennessee, and she was talking about how we always assume that heterosexual women or other people don't know that their men are on the down low, right? There are some women who are having sex with persons or with men, and they know their other activities and other sexual behaviors, right? So I think we can move away from that just a little bit. Like, there are people who do know. I don't think all heterosexual women don't know. There are some who do and love the people that they're having sex with just the same.
Right. I hear you. Right.
And I think it's a great opportunity to mention that we even have the South Carolina MSM work group who really have a lot of robust conversations around topics like this.
Now, what is MSM?
I'm sorry, Men Who Have Sex with Men. The South Carolina Men Who Have Sex with Men work group. It's a group of, and a collaborative of different community-based organizations, community members, anyone who really wants to have the conversation about kind of the health of men who have sex with men. And so SCDHEC actually funds a conference each year that supports a lot of the conversations that we're having today as we talk about mental health and as we talk about HIV testing, as we talk about linkage to care, retention in care. And so that's a great opportunity if there is a person who feels as if they would like their voice heard or to be a part of that conversation with us, then they're more than welcome to be a part of that. Again, there, as Sean said, we kind of need to move outside of just thinking one way about sexuality. Because for some reason in South Carolina, we think that DL men are always on the down low, and they're really not for the most part. And some of them are very open, where you talk about, polyamorous relationships, and you talk about open relationships and things of that nature. And so that's all that I have to say on that.
Well, it's important because I didn't want to give the impression that men who love men were somehow responsible for peaks that we see in incidents of women with HIV and AIDS, because that's not what the research says, right? Am I right about that?
Yeah.
The researchers, however, I think people need to know, as you guys were beginning the discussion about how complicated it is and how involved it is for men that are conflicted in that way. And yes, Jim, you have a question.
Yes, and both of those questions kind of lead into this question. I wanted to ask about the polyamorous relationships, because I noticed that the younger and younger teens are becoming more and more polyamorous, and it's almost glamorized to an extent, and it's unprotected, largely unprotected.
So polyamorous means sex with a whole lot of people?
Oh, yeah. So
Thank you.
I'm just asking. Is that what it is?
I can kind of chime in. If I can kind of chime in, I just learned about this.
Sex with a lot of people or everybody?
I just really learned about this myself.
Everybody?
Trisexual,
Men?
yeah.
Trisexual?
So really, there's really different dynamics of polyamorous relationships. You have polyamorous relationships where there are different agreements as to who does what with whom. But polyamorous simply means more than two people within a relationship. And it's hard to believe because we live in the South and we live in the rural South for the most part of not sticking to the standard of man and woman and we're going to be in a relationship. But there are people who enjoy the company and the love of multiple people. And it's very much acceptable. People have been doing it for years. You just didn't know the name of it.
called swingers.
Yeah, so
Swingers.
swingers and polyamorous are two different things. Polyamorous relationships are really a actual relationship where all people involved, where all persons
It's
involved,
consent.
it's consent.
Kind of like R. Kelly?
No, that But in polyamorous relationships, everybody in the relationship has an agreement that they all love each other and they all care for each other in the same way. Now, the difference between swingers is that's kind of a one-time or two-time or three-time, however many times you want to swing. But there's no relationship, there's no connectivity there. And so there's different dynamics and different agreements when we talk about polyamorous relationships. And we don't want it to get confused with polyamorous versus swingers or open relationships and things of that nature, because they all have different dynamics that we take into
So let me
account.
give you the definition according to Mr. Google.
Okay.
Characterized by or involved in the practice of engaging in multiple sexual relationships with the consent of all people involved. It says intimacy and trust are essential to successful polyamorous relationships. So they have intimacy and then they have trust.
Right.
So there was a book.
consent.
Oh,
And
Consent. And consent.
Right.
There was a book I read in seminary, and it's called The Ethical Slut, right?
Ooh,
and
okay.
and it talks about opening
about
the
oxymoron.
conversation from moving from monogamous relationships to open and polyamorous relationships, and I can't remember the authors of it, right? So as a preacher, I was indoctrinated into this belief that all relationships have to be male and female, or not just as a preacher, but as a person, right? When we and these are a lot of the conversations that are happening now, right? That the standard for a relationship is male and female, and we know that's not true because there are people who are living other experiences. But this book helped me to realize that there are people who are having conversations around consent and are having sex with other people in ethical ways that includes consent, right? And we have to have those conversations as people who are advocates or people who work in this field around those individuals who are having sex, even if it's one time, right, with somebody that is added to their relationship or outside of their relationship, right? Those persons are having these conversations with each other and are inviting other people into their relationships in ethical ways.
Wow, The Ethical Slut, A Guide to Infinite Sexual Possibilities. It's an English nonfiction book by Dossie Easton and Janet Hardy. And Janet Hardy is her pseudonym. It's a pseudonym for Catherine A. Litz. And it's got 3 editions now.
I got 2 of the books. Because at one time, I was considering what does it look like for me to be in an open relationship or to be in a polyamorous relationship. And I needed something because I wasn't having these conversations right at home or with my other partners, but I needed something to kind of move my mind in a way if I myself wanted to explore that opportunity for myself.
So do you ever have the conversation about, do you know your status when you enter these relationships?
So that's part of the conversation.
Oh, that's part of the
So just like you read the definition for Google and it said something about trust, that trust also is inclusive of your health as well. So just as you would with someone that you were in a single gender or a single relationship with just another person, you would definitely need to have that conversation about, HIV status and STIs, and it's the same conversation. So everybody's safe and everybody's included.
And people need to know at the MSM conference, those are the conversations that you're having. And what people, the first few years it was packed, jam-packed, and over the years, the conference attendance has gone down a little bit, but I'm not sure why. Is it because people's status is they're comfortable now with their status? Their viral load is low?
I think in conjunction with kind of revamping the MSM work group and our goals and initiatives, I think that over time we just experienced uplift in kind of the interest of the Institute. But this year we're partnering with new partners, and the Institute will look a lot different than it has in the past. And so you will definitely be missing out on a great educational experience if you're not there this year. So we hope to see you all there.
Okay.
And I
I
want to
have
add
a
something
question.
real quick. Not all persons who are in polyamorous relationships are in them for sex or are having sex in these relationships. Not even in polyamorous relationships. Persons who are in relationships with other people, not all of them are having sex, but they are having these conversations around status and stuff like that.
Okay.
Right.
My question is, when will be the next training on this latest trend of things that's going on? Because I'm sitting here on the panel and I'm an advocate and I'm just as lost as hell. Excuse my French.
That's all right. You don't know about the polyamorous
Yeah,
stuff?
that and the next phase and the next phase and the next phase. You know, because this is the stuff that I need to know, and I think that being a heterosexual woman, I need to be educated about this. So
Well, that's
that I
why
can
these
be-
talks are important, right?
Yeah, you know, and I need to have this talk so I can be. I thought I was worldly, but obviously I'm not. So I need some more training, okay?
So,
and I'm willing to train. And please put some funding into women's, because you guys have a lot of funding, and we women's do not have funding.
Gotcha.
I would just like to invite you to my course that we teach quarterly at DHEC. And it was, I mainly created it from scratch because we had nothing at all. And from our needs assessment, from kind of assessing our community partners and those that we fund, one of the major things that they one of the major themes that we saw that was reoccurring over and over is how do we engage and what is the culture of MSM? We need to understand this more. We don't know how to talk. We don't know how to, what do we say? Oh, they seem mad all the time and all this other stuff. So I created a training that is an all-day training that is called Culture and Engagement of Same Gender Loving Men. And basically it goes through kind of all of the spectrums of being in the LGBT community and also being a same gender loving man. So we don't talk about just African American MSM or African American same gender loving men. We talk about Latino, we talk about Caucasian, all of that, and kind of break down the barriers to them being able to communicate and knowing the culture of. And I'm sure that there are some other trainings that that can be offered as well, but I invite you to mine.
I need all the training I can get.
And they're free.
And they're free, yes, absolutely free. Anybody can come.
And I'll bring my rude women's with me.
Dr. Shaw, introduce yourself, please.
Hi, Todd Shaw. It's my pleasure to be the PALS board chair. I teach over at USC, and I'm also very proud to be chair of a new organization called the Colombian Coffee Club, which I can talk about at some other point. But real simple question, which usually not, my friends who know me know I don't ask simple questions, but simple question is, as health advocates, what is both the upside and downside to this statement? Well, and not knowing my status as being a positive person or wanting to prevent, all I have to do is take a pill. So how is that complicated? How is that a good thing? How does that complicate but also make the work more productive? How do people might take that too lightly or not, or be too worried? So how is the idea of all I have to do is take a pill a complicated thing?
Looks like everybody has an answer for that one.
Well, for instance, for young people saying, I'm not going to go into prevention because if I get it, all I got to do is take a pill. And so, this PrEP thing, take the pill, and then I don't have to worry about any other STD. So how is just taking a pill? How's it complicated and complicate the work sometimes?
Sure.
What riskier sex behaviors?
Riskier sexual behavior?
Yes.
I would also include being complacent and relaxed, because if you know the only thing you can do is take a pill, then of course you're going to be more prone to have more risky behavior. So even when we talk about PrEP, I'm not HIV positive, but I am on PrEP. And even though I'm on PrEP, we talk about medication adherence. Oh, you need to take the medication and all this other stuff. I can't even take a PrEP pill every day. And along with that, I take, my blood pressure medication. I miss days. And so I completely understand how, just being lax and just having to have the responsibility every day to take a pill, can kind of, especially when they give you things like, oh, you don't have to take them every day. You can just take them a certain amount of days and you'll still be protected and all this other stuff. And so with that, I think education and the messages that we send out is very important because words matter. And so we need to make sure that we are making, taking medication an urgent thing, making sure that it is a priority. And it can be an issue over time if someone isn't as serious or isn't as enthusiastic about taking their medication every day. It is what it is. I take my little PrEP pill in the morning when I'm in the mirror and I feel good about myself and I have music blasting and I just pop my little pill and go.
Okay.
So I think complacency is one of the factors.
I'm also interested in what the research says.
So I think it's important. That's an important question, right? Because on one end, I'm grateful that there is one pill that people can take to either, or multiple pills that people can take to reduce their risk of acquiring the virus, but also I'm grateful that there are one or other multiple pills that people can take to allow them to be virally suppressed. I appreciate that. But on the other side of the spectrum, I think we have those conversations as if viral suppression is the end-all be-all to what it means to be a healthy person living with HIV, right? Viral suppression is good, and we want persons to achieve viral suppression, but there are other things we want people to do also when they are virally suppressed. We want to know, like, I'm a person, I eat fried chicken every single day if I could, right? Right? I live in Aiken, and there was like a hepatitis outbreak, so I
saw that.
So I didn't eat anything from Popeyes. But I did have my roommate cook me fried chicken, right? Right? But what else am I putting in my body, right? I think, we need to move from taking one pill a day because there are other things that we have to do to ensure that I'm living, that I'm healthy and whole once I do take my one pill a day, Dr. Shaw, right? Make sure, like, or am I attending to my other physical needs? Am I attending to my mental needs? Am I attending to my spiritual needs, right? All of those conversations are also important for people who are living with HIV and people who are not living with HIV.
So do you need some of my blood pressure medicine?
No. Not yet.
Now let me give a station ID. You're listening to On Point with Cynthia Hardy. Our topic tonight, Know Your Status. HIV Testing Day is coming up on the 27th of June. In recognition of that, Carmen Julius, the president and CEO of Palmetto AIDS Life Support Services, is sponsoring today's show. We're a live town hall broadcast in the community from the Cecil Tillis Center. I want to shout out the Housing Authority for its effort to make the facility available for us. We were talking about what the research says. Doctor, tell us what it says.
Well, there's a lot, but my name is Dr. Alyssa Robillard. I am an HIV researcher, also vice chair on the board of PALS, and I'm really excited about this conversation that we're having. It is indeed robust, and I'm appreciating it. One of the things that you mentioned, you talked about PrEP, and we know that PrEP is upwards of 90% effective when it's taken consistently. However, I know I see the commercials everywhere. Take PrEP, take PrEP, take PrEP. I'm not sure that everybody knows what PrEP is, and I wanted to ask you all to speak to what PrEP is and I guess where we can access it. What are the drawbacks to it, if any? If you can speak to that.
Thank you.
PrEP is an acronym for pre-exposure prophylaxis. So the P and the R, if you've ever seen PrEP, the big P and little r stands for pre, and the E and the P is exposure prophylaxis. And what that basically does for you is it prevents HIV from getting into white blood cells if you come in contact with it, and it stops it from from replicating. And so it's a once-a-day pill that you take. The name for it is Truvada, and the maker of it is Gilead, and it's made by Gilead Sciences. And as stated before, it is up to 90% effective for those who take it as prescribed by their provider. You have to have a prescription. You can't go buy it off of the shelf. And so once you're prescribed PrEP from your provider, then you are to take it every day. There's no skipping or anything of that nature, because once you skip, then you lower the effectiveness of PrEP. Also, for those who are intravenous drug users, is up to 70% effective. And so there has been research that has proven that PrEP really is effective overall in preventing HIV transmission, and a lot of states have seen drastic decreases in HIV incidence because they've kind of beefed up their PrEP initiatives. Those states also have a lot of money for PrEP, and unfortunately we have absolutely none. So we've kind of had to make do as a state with what resources we have. We have kind of maneuvered, with and negotiated with our agencies. So now all of our agencies that DHEC fund, we do some type of PrEP, whether it's PrEP referrals, or if it's PrEP, the comprehensive PrEP, meaning that they can get the PrEP, they can get the test done, the diagnostic test done, and also can be seen, on a regular basis. But after you are prescribed PrEP and you have your test done and they come back negative, you have to be HIV negative in order to be on PrEP. Once you get that test back and it says everything's A-OK, then you will definitely need to come back every 3 months to have diagnostic tests done to make HIV 1 and 2 tests, and also your STD testing, as well as your liver and kidneys need to be checked every 3 months as well to make sure everything's ticking. So that's basically PrEP in a nutshell. If you have any questions about it, you're more than welcome to email us at prepmesc@dhec.sc.gov.
Awesome.
And Bobby, also they can go to the website, to Gilead website, and you can get information, because Gilead, they're the company that promotes that, but they also are pouring money into organizations who have HIV training, HIV testing, and so they're doing things in the community as well. And I know people don't know about this is new, but it's Gilead, and Gilead will send you to a conference to get educated about what's going on with HIV/AIDS.
Okay.
And I really want to say that we do have a PrEP clinic at PALS. You can make an appointment with us at 803-779-7257. Again, 803-779-7257. And we're able to accommodate late evening and Saturday appointments. If you give us a call, we'd be glad to serve you. We do PrEP education, PrEP medical care, and we'll be able to follow you up with your prescription and maybe even assist with the cost of that.
Awesome.
And I do want to add that the recommendation is that persons use PrEP with a condom, because PrEP only protects against HIV and not other sexually transmitted infections. So the recommendation is PrEP with a condom.
And it's only 90% effective.
Right.
There's 10% hanging out there somewhere.
Just hanging.
But that data is so important to our listeners, because we don't want them to think that we have all of the answers to safety and all of that, because it's so important that we get educated on this, and then we can live once we get educated.
That's right.
One of the questions that we have for the panel is, how do racism and classism impact the HIV/AIDS epidemic in South Carolina?
All right.
Sean, you have 5 minutes.
That's why we don't have no money, because the African American population is the one that is affected about this illness, point blank. Now they may make it sound pretty.
So I actually love this conversation, right? And this is a conversation that leads into what we know as social determinants of health, right? Yes. It tells us that based on who you are, where you live, where you might work or worship, that you might be at a higher risk for acquiring some diseases like HIV, like high blood pressure, like diabetes, right? And what we also know is that African Americans are not having riskier sex than other populations or groups of people. We're having the same types of sex as other people, but we see that rates for African American MSM and heterosexual women and trans women are higher. And
Reverend, I'm wondering if you believe this. I'm going to throw it out there, and you're welcome to chime in too, Ms. Hopkins. Do you think that is the case because of our access to quality health care?
And so that's a part of the conversation,
Or lack
right?
And
or
a
the lack of, right?
Okay.
When we think about how racism works on like very systematic levels, right? When we see that places are being rezoned, right? So that people who look like me might not get access to quality education, right? When we're thinking about where people strategically place health facilities, so that certain communities of people don't have easy access to the same level of care as other communities of people, right? And the foundation of this is racism and environmental racism, right? When we think about where they place trash dumps around the city, they're usually in communities of color. When we think about where they strategically place the ABC stores, where they place fast food restaurants, where they place all of these things, they're strategically placed in certain communities of people so that we have higher rates of high blood pressure, diabetes, and all of those things.
crime.
And crime, right? So I used to live in New York City, right? And when we think about where the train stations were located and how far it took a particular person to walk to a train station so they can get to their medical appointment, all of those things are strategic and systematic. Now, let's have the conversation in South Carolina. I had family members. My family is from Sumter, even though I was born in Philly. My family's from Sumter, right?
Born in Philly.
Born in Philly. And I lived in New York, and I've seen how racism moves throughout different areas. When we think about people who did not have adequate transportation all of my family members actually received their care in Columbia, even though they lived in Sumter.
Wow.
Right? And I found out years later that most of them were clients of PALS before I started working there or before I became familiar with PALS, right? But that's strategic that my family members had to come to Columbia, right? Because of racism and things of that nature.
You're listening to On Point with Cynthia Hardy. We're going to take a short break so that we can thank our sponsors and also get everybody lined up for the next phase of our conversation. We're talking today the significance of knowing your status. HIV/AIDS testing day is coming up on June 27th, and our show today is sponsored by Palmetto AIDS Life Support Services, also known as PALS, where Carmen Julius is the president and CEO. We'll be right back. When we come back, y'all gotta clap us back on the air.
How long that is?
And certainly,
So are we really on break, Brian?
Huh?
Are we really on break?
Yeah, we're on a break for about a minute.
Okay. So we keep turning this off. Is that affecting anything down there?
I'm not supposed to turn it on.
Yeah, we're not needing to.
We are still streaming live, though.
Yeah.
This is a gap.
Oh, okay.
Yeah, keep that. I'll pitch to you, and then you bring them up. Okay.
Dawn, how long we got?
Jim and Allison.
Yes.
30 seconds. 30 seconds.
30 seconds.
30 seconds.
You ain't gonna make
Welcome back to On
20
Point.
seconds.
We just going to acknowledge that you're here and we'd like to make a comment.
Oh, not yet.
She's going to just
Here we go. Okay. 10, 9, 8, 7, 6, 5, 4, 3.
At the Tillis Center. The event that we're doing today is a town hall, and it's sponsored by Palmetto AIDS Life Support Services. I'm standing here with Carmen Julius, who's the president and CEO of PALS. And Carmen, thank you again for sponsoring this show with On Point for our community today.
Thank you for having us. And Cynthia, I think it is important that we note that some of our elected officials are here today.
Yes.
We have Councilwoman Allison Terracio and Councilman Jim Manning, and I'd like to ask them to just make a comment for us, please.
Sure. Hi, it's great to have this honest and open conversation. I have now a new book to read to order when I go home, and I'm so glad to see so many people here from the community out in the audience and people participating and asking questions. thank you all so much for doing this.
Absolutely. Now, when you talk about policy and things like that, Councilwoman, what are some of the ways that you feel as if what you do can impact what we do here?
Sure. Well, I think one of the comments that was made was about how here in South Carolina we don't have any money for things like PrEP, and you know, I'm a believer that if you value something, you can find money for it. So, you know, if it's not at the state level, it's not maybe at the local level, we can make sure that we've got funding for things like this, because it really is about public health, and it really is about community and taking care of each other.
Sure, and it's so significant that we be able to have people in positions like yours, access to budgets and such, because that gets us closer to the resources. So thank you very much. What about you, Councilman?
Thank you very much, and it is an honor to be here with Councilwoman Allison Terratio. The Cecil Tillis Center is in her district.
I see.
And I think it's so important to have the local elected folks here. And also want to say, Francina, you talked about women and how they're not treated equally. And Richland County citizens are very fortunate to have Councilwoman Terratio on the council. She is always in the forefront of every discussion at Richland County Council about equity, particularly in terms of pay, and that women are not looked at as second-class citizens. So she does an excellent job in that. And Ms. Hardy, that's another example of the importance of elected officials and what they can do in terms of policy.
Certainly.
And thank you to everybody at PALS for the great and wonderful work you do, the board leaders, and Carmen in particular. Thank you for pulling this panel together and for you doing that with On Point.
Thank you. Thank you very much. Let's give our council members a round of applause. Any other comments you guys have?
They said I didn't say my name. My name is Jim Manning.
I just figure everybody knows you,
Sandra
Councilman.
Manning's husband, unfortunately, and I represent District 8.
Thank you so much, Councilman. Thank you. You know, we probably have about, 15 more minutes, Diamond, on the show? About 15 more minutes. So I do want to give folks in the audience an opportunity to speak. If you all would like to, before we get off the air, before we come back up here to these guys, because once I turn it back over to them, y'all ain't getting it back. I know Oh, 9 minutes, they told me. Okay.
Well, my grandmother is listening from Philadelphia, actually.
Oh, shout out.
So my cousin called her on put the phone to the radio.
And I know my family is listening. I've got family members here from Alabama today celebrating the 9th birthday of my niece, Maya Walker. I had a sleepover yesterday, Marnie, with all of her friends from Hammond, and it's just a very loud time with about 15 9-year-olds, but 9-year-old girls.
Wow.
All right.
I know we have a lot of folks, I'm Michelle Harris, and I wanted to ask about, we talked about access to care and coverage and insurance, and how has PALS, or what kind of programs do you have to help people once they have found that they need those services but they can't afford them if they're uninsured or underinsured? What do you all do to help?
That's a great question.
Yes.
Well, at PALS, we try to make sure that our services are accessible, and that includes affordable. We have a sliding fee scale. Again, for a test is $15. We don't wring your arm if you don't have that $15. We can give you a waiver depending on what population you represent. We have a great staff of case managers and social workers and staff who can help you through some of what they call patient assistance programs. And those programs can actually help you get medications at no cost, can help cover the cost of your medical visit. So everybody doesn't have to have insurance. If you call us, let us work with you. Again, our number is 803-779-7257. Call us and let us work with you. We can work through those things. Again, we have a whole staff of caring and compassionate people, many of who are here today, and we're waiting for you. Come on in. We want to get you in care. We want to keep people healthy. We want you to live.
Absolutely. Yeah. Now, you know, one of the things that, the questions on my little cheat sheet that Michelle Harris gave me, we were talking about what happens in our communities with with the faith community. Wouldn't it be a great idea if pastors would get tested first as a real example for their congregations? I wonder if there's any talk about asking them to do that.
And we have in the past had pastors around the state who were gracious enough to welcome us into their church and to their congregation and get tested in front of their congregation to encourage engagement in testing.
Awesome.
We have not had enough of that.
Okay.
We will welcome an invitation from any congregation to come out and talk with the pastor, talk with the congregation, and to get people tested. So, give us a call, 803-779-7257.
We got 6 more minutes on the air, but I just want to acknowledge what a great leader Carmen Julius is.
Yes.
And that, we could do with hearing more from her, in our community. I just want to say that to you publicly, Carmen. What an awesome leader you are.
Yes.
This is a tough job under some tough circumstances, and you're a tough lady. So thanks for doing it. Yes, our next question.
My name is Joyce Belton, and I want the panel to please explain to the audience what's the meaning of U equals U. Because I heard Ms. Carmen talking about staying in care. Could you please break that down for me?
Thank you very much, Ms. Joyce.
Keep it simple, please.
So I guess it's me. So U equals U is another public health strategy, and one of the things that are part of the HIV continuum is really trying to get people into HIV care and to make sure that they are virally suppressed. And basically what that means is the amount of virus in the body is below undetectable levels.
Okay.
And so with that, the way that can happen is by a person being on their antiretrovirals, their medications, and taking them regularly and as prescribed by their physician. And so with that, U equals U means undetectable equals untransmittable. So U equals U. Undetectable equals untransmittable. And there has been research that has found that a person who is less than 20 milliliters per blood will not transmit to another person. So if we can get all of our HIV positive clients to adhere to medication, take the medication, get them back into care, and really kind of follow that regimen, we can definitely reach ending the epidemic.
And guys, this is the time of the show when we're going to start with our closing comments, okay? And so we're going to start here and go down, all right? And then Marnie and I'll wrap up. I want to let you all know what a pleasure it's been to be here with you all today and to bring this live show from the community. And please, ask us again. We're having a ball.
All right.
Go ahead. We got 4 minutes, guys.
Okay,
Go ahead.
I'm Francina Hopkins, and I live in Lexington, South Carolina. We need access to care. We need support. We need money because we are being left behind. Point blank. We are not receiving what we need in order to put a stop to this epidemic. And as long as we're being left behind in the rural area, we always going to have this epidemic.
But we want you to keep on with your outreach out there.
Thank you.
My name is Reverend Sean Torres, and I do want to say that people who are living with HIV are valuable, right? They are worthy of love. They are worthy of acceptance. They are worthy of all of the things that everybody else is afforded, right? And we need to start having those conversations, including people living with HIV, that tells them that they are loved.
Yes, right. Absolutely.
So I just want to really just kind of reiterate the opening statement that I made about kind of our 3 main points and goals as a statewide effort. We definitely want people to, first of all, know your status and get tested. It's not that bad, I promise you. Once you get over the first, scary experience of getting tested, after that it's a breeze. Secondly, we want you to make sure that you link to medical care if you are a person who's living with HIV. And so with that, we want to make sure that you have a quality or a better quality of life, and to make sure that you're getting everything that you need. There are other services that can be rendered to you if you definitely come in and see these agencies like PALS. They have other services that can definitely be of benefit. And the last thing is to ensure that you are retained in care. So staying in care and staying healthy.
Absolutely. And the closing comments are reserved for Ms. Julius.
Again, Palmetto AIDS and Life Support Services is active in the mission to end the epidemic. And we want people to be healthy. We want people to have access to care. We want a healthy community. We're asking everyone to know your status. Bring your boyfriend, your girlfriend, your sometime, your now and then. Let them get tested.
Get tested.
We want everyone to know their status. And if you are positive, we can work with you to keep you healthy for a long time. If you are negative, we can help you develop a plan to stay negative and stay healthy. Give us a call, 803-779-7257, or our website, www.pals.org.
And all the people on the panel, Bobby Rogers, Reverend Sean Torres, and Francina Hopkins, if people want to reach out to them, can they reach them through you as well?
Absolutely. We can connect you with any of these wonderful people. And again, our wonderful staff is always on call in our office.
Well, thank you so very, 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 very much to PALS, Palmetto AIDS Life Support Services. Marnie Robinson, you have a closing comment?
I just want to remind everybody that the MSM conference is coming up August 22nd and 23rd, and it's going to be on the campus of Brooklyn Baptist Church at the Banquet and Conference Center.
Awesome, awesome. You guys are so in the community. I want to thank this wonderful, wonderful studio audience. Yeah, I'll give you Stroman, thank you so much for being here. I also want to thank Nita in her absence. Diamond Chambers, thank you for being here. Alex, thank you for being here as our engineer. And Marty, thank you too. Go ahead and give that announcement, Carmen.
We will be testing on Tuesday, June 25th from 10 a.m. to 8 p.m. at PAL's office. And again on Thursday, June 27th at Walgreens, 7212 Broad River Road in Irmo. Come on out and see us and ask about PrEP.
All right. And I also want to shout out Celeste Cannon, who's not with us today, but she's here with us in spirit, and Jordan Miller, who is here with us as well. Well, Marnie, I think that's it. You guys, we believe it, and we hope you do too. When you're informed, you're empowered. And once empowered, you are on point. Get your